Wishing you a pleasant day and wishing you a very warm welcome to our favorite show, iMed, where we discuss health concerns and giving you advices with regard to health issues, and not letting you in trouble is our prime concern with regard to this series of programs. So ladies and gentlemen, today we were deciding to focus your attention on a very important and essential topic when it comes to family life. And before introducing that, I'll introduce our guest. So to do the honors with us, we do have Dr. Sudat Senaratne, consultant in subfertility and IVF. Thank you very much, sir, for joining with us with today's program. And with this esteemed personality, we are going to discuss about subfertility and certain other consequences. And sir, to give a start off to the topic, what subfertility is?
Yes, subfertility is defined as lack of fertility. When couple try to get pregnant and they fail, we define as subfertility. But whereas compared to infertility, it's more or less a scientific term. A young couple less than 35 years of age and trying for with regular intercourse within 1 year, if they fail to get conceived, and we call it infertile.
Right.
The definition itself defined that they need some kind of assisted medical treatment for to get conceived.
Right.
Yeah, that's basically the difference between subfertility
and infertility.
Yeah.
Then sir, like for infertility, we should definitely have some sort of a medical intervention. And
Yes.
for subfertility, is it necessary?
Yeah, subfertility is just layman term. It doesn't imply on medical treatment. That
Right.
means that some couple not conceiving, they feel that they're subfertile.
Right.
But in medical terms, to be infertile, at least they should try about 1 year, because if they're healthy and having regular cycles, about 80% of couples will get pregnant within first year.
Right.
So that's why we wait for 1 year, provided that they're young.
Right. So with regard to that presumption, we consider those definitions, and when it comes to subfertility being not a proper precise medical term, but with that precise definition and understanding, 80% the percentage and the time duration 1 year, that should be concernable. And moving on, sir, what are the incidence causes for this?
Yeah, if you are young, less than 35, but 10% of couples are we consider as subfertile, but the incidence is slightly rising over the years, because many factors contribute in that. So we find many more couples are being investigated for infertility.
Right. So what are the issues with this subfertility and infertility issues?
Mainly infertility defined in three categories. One is the primary, they never succeed getting pregnant. Then there's another group which conceive, we get pregnant, but they fail to carry on for term to deliver a term baby. That's called recurrent pregnancy loss. And third category is we call secondary subfertility, who are fertile and have one child and fail to conceive again. That's we call secondary subfertility. Mainly there are three groups, but we see more on the primary subfertility. They never, they fail to get pregnant at all. So that's the fine.
Right. So if we move to repercussions for this topic.
Yeah, mainly so when couple feels that they are subfertile or infertile, it carries a social stigma. They're very worried, and they feel that they are guilty or they are cornered, and the mental state is not not as healthy as it used to be. So they have a lot of domestic issues, and their performance will go down. They are not socially moving out. So there are a lot of social issues associated with subfertility. When couple trying to get pregnant and they fail, it has mostly negative effects on their lifestyle as well as to the society.
Right. So this is a disease condition. Sometimes it impact to the society. There's a social impact and family issues are there. A lot of things should be concerned, and certain types of when a patient comes to you, might be there are certain psychological concerns as well to deal with this thing. And so when it moves to the real causes of this disease, how can you explain those?
Again, causes we can categorize them as female causes. As a gynecologist, we usually look into mainly on the female causes and the male causes and combined causes, and there are few we call them unexplained.
Right.
Over the years, when I started my career about 10 years ago, the unexplained category was about 30%. Now with the development of technology and science, now it's come down to 10%. We understand the physiology and the pathology of fertility more.
That means how they perform and how the diseases occur.
Yeah, I mean, what are the where they fail. We understand by the technology, and we have a lot of technology advances, so we can intervene in the normal physiology, and we can make them pregnant. So unexplained category have become smaller, about 10%. So the other three categories are more or less equal.
Right. So when it comes to certain other like disease conditions which will pave their way, so normally we heard like COPD, not COPD, PCOD. Like there are certain names that normally they used to have, and they term them in a certain manner, but they don't have a medical knowledge. So when it comes to a certain that type of a subjective explanation, how can you explain those, sir?
Yeah, there are a lot of medical, I mean, not a lot, but there are some medical issues behind the infertility in the female, especially when it's come to like they should be in the ideal age. So the main challenge that we have in treating is the age factor. So now the priorities are different. Most of the females try to study further and like to be a career woman, so they postpone their marriage and to get pregnant bit late. So because of that, unfortunately the ovarian reserve it doesn't grow up. It by every year, every day it goes down. So the main critical factor is the age. We have to consider. You have to have a certain window of period of time to get pregnant, and if you pass that, unfortunately there's very little that we can do to bring the fertility back. Compared to what you said, the medical conditions, like you said, PCOD is a main condition, one of the main condition for infertility in female, but actually we can manipulate that. So we can, lot of things we can do, actually the patient can do to overcome the infertility issues. And on the other hand, there are diabetes, hypertension, and thyroid function problems. Those are the common things that we have in medical condition that affect the fertility.
And we'll move on to that type as well. And so like with the explanation you said, there will be a certain age limit for the proper functioning, and sometimes later on there will be certain malfunctions or dysfunctions or whatever it is that is not functioning properly. So can we define a precise age limit? So in the society there are certain concerns that before 30 you have to get married, or like when exceeding 35 you will lose the hope of having children. Is that so? Any medical reasons behind?
There's no age limit that we say that you can't have pregnant, but it's better to. We prefer them to have, it's not like a marriage time, you can marry at any time, but to conceive, the best would be for you, for your couple and your children, would be between 25 and 35. We basically advise to complete family before you achieve reach 35 years of age. But still you can have some hope after 35, because I mean when you grow old, like you should have a proper age gap between your children and you. So it's ideally it's between 25 and 35 is okay. But there's no rule like that.
No rule like that.
That's basic general idea to conceive. I mean, finish your family before 35.
Before 35. And so like some people tend to say that the first child should be born before 30. Is there any logical reason behind?
Not so, but still you can plan it. It's very important to plan your family. When you, like even you're not married, you can have roughly idea about the ages that you want to get your children. So in our point of view, we prefer to them to complete family after the main reason is your ovarian reserve. That means the number of eggs that you have, good eggs that you have, will decline very rapidly after 35 years of age. So there's a bit of medical challenge after 35 to get someone pregnant.
Right. So with that explanation, I think it's very much clear for you. Completing the family before 35, that 35 is not exact 35. You can have some hope, but there are certain medical concerns, the ovarian reserve, as doctor explained. There are certain medical issues, so you must plan them, and marrying any time is quite okay, but with proper planning and proper methodologies implemented, you'll be quite okay with those types of issues. And so like when we were talking the previous question, and you came out with some non-communicable diseases which is not been transmitted from one person to other person, but they affect the normal daily routine. Might be diabetes, that means high blood sugar, that means high pressure, or something like that, high cholesterol levels, hypertension and certain other conditions. With those types, because normally if we take the population, the majority as in like a considerable portion of the population, they consume those drugs, that means they suffer from diseases. Will it be an issue for pregnancy?
That's another good thing that you told. Incidence of those non-communicable diseases are increased after 35. But out of that, the main worry is the thyroid issues. So when you have a problem with the thyroid, you might fail to get pregnant. But on the other hand, you said diabetes, hypertension, or high cholesterol levels will not affect the fertility, but will have some issues when you are pregnant, because your blood pressure might go up. You need to have a very precise control of your blood sugar to have a healthy baby. So those are things which is under control, but you have to control those things well before you can conceive. Otherwise, it's very easy if you have very good control of your medical conditions, non-communicable disease, prior to getting pregnant. That's why we want to see couples when you plan pregnancy. So we just have screen them, and if they are found to have those kind of illnesses, we can advise them how to control, and then we can advise to get pregnant. So the journey will be easy then.
Journey will be easy, and if there will be certain conditions, or if there are certain conditions with proper medical attention and intervention, you'll be having the proper investigations, diagnosis, treatments, and you can plan the entire life and being pregnant or having the hope of having children. And so moving on to the next most important thing is that when a couple is getting married and they're expecting children, with these types of issues, delayed pregnancy or not conceiving a child is the major concern. And some people tend to say this is the total fault of females. Some say no, our family is healthy, this is with regard to the issue of the male person. So is it male, female, any higher percentage, or what is that?
Yeah, I mean, as a gynecologist we look into the female a lot, but when we investigate subfertility, we take as a couple, as a family. So we have to consider those inputs as well. So one of the most commonest factor that we consider is the social stress, because being in the Asian country, we have extended family, they are very close by. So people expect when a couple get married to get pregnant soon. So one is Tambabala. So there's a bit of a stress factor.
Yes.
Even they do not plan for a pregnancy, people ask. So this is one of the main thing that we have to get rid of. Usually when we counsel as a couple, we basically advise them to not to take those things seriously. So plan on your own, and when you have happy to get pregnant, we'll think about that. So it's important to have your fertility assist to see where you are in your fertility potential, and if you're okay, then you can plan your pregnancy. But as you said, there's a lot of social impact, as I said earlier. It's a bit of a concern.
Right. So the stress condition is the most important thing that we have to manage, and the thing it is impossible to manage.
Sometimes very difficult, yes.
Yes. So the impact from the society and impact from the closest relatives to a couple which is expecting a child will affect these types of concerns as well. And so like with regard to those things, if we are planning the pregnancy in a proper manner, keeping up all those factors, you told about a certain test, that means a capability test like thing. So but how can it be done, and what is it?
It's basically individual. As I said, I just broadly said it's 35. Even I have met some couples, even at 35 their ovarian is very poor. So it's not multifactorial. Your history should be explored very well to identify your risk factors. So especially if you're thinking of getting pregnant in your late years, especially females, you have to have your fertility assist. So it's basically customized to certain the individual. So we have a lot of tests. Basically, we have run blood tests and a scan, and see where you are. And if you are not planning pregnancy soon, we can correct them. What we can't reverse is the ovarian reserve. As I said, with your age, your number of fertile eggs, capable eggs, go down. We can't bring them back.
Right.
All other things, I think, with medical technology we can control.
That means, sir, like when it comes to a family, we understand that, and when it comes to childbirth, we experience in some conditions, some children have certain lack of certain functions. For an example, Down syndrome, there are many effects with regard, because anyone don't expect such, and but if there are, we should help, and we should help in rehabilitation, and we should not neglect them. This is not neglecting such, but when it comes to those concerns, with that previous diagnosis, investigations and testing mechanisms and planning that thing, we can minimize them, is it?
Exactly, yes.
Right.
Yes.
So
we can actually have prenatal diagnosis, that means before birth we can see that the child is healthy. Yeah.
So we can just follow them and properly advise the couple if there is any risk factor, and we can manage them, suppress them, curb them, and go to the...
That's the basic idea, is to prevent.
Right. So with regard to the other diseases, NCDs, that means diabetes, high blood pressure, cholesterol levels, and certain thyroid issues, there are many. So you have to take proper medical advices for your diseases and prevailing conditions. And most important thing is that if you have some concerns about those things, go to a doctor, take their advices, and follow proper investigations, and continue with successful correct way of medication, so you will be not falling into trouble. And so, like we talk about delayed marriages and many other things, are there any other risk factors we should concern in this?
Yeah, when you talk about the female fertility, so as I said, we should have first one is the good ovarian reserve, then you should ovulate. There are certain conditions they don't ovulate. For example, if you are not having your regular periods, it get delayed, then then you might have some issues with your ovulation.
Right.
Then the ovum should, the tube should carry the fertilized egg. So then you have to have healthy tubes. Then finally we have a good endometrium to implant. So endometrial factors or uterine factors. Those are the four main problems or concerns on the female infertility.
Right. So when it comes to males, how can they manage?
Males, primarily age is not a huge factor, but now we find that after 40 the male fertility goes down. But it's like a simple test, seminal fluid analysis will reveal the potential of a male factor. Unfortunately, if you have a problem with the male fertility, it's a bit of a difficult, but with the technology, with IVF, we can, you need only one sperm to conceive. So you can conceive. So you can basically, male infertility is not a big issue or a challenge at the moment.
Right. So as you are a consultant in that particular field, can you just explain a little bit to our audience what IVF is?
IVF, when you have, especially we recommend IVF for the group we call unexplained fertility, or we have tubal damage, or we have fertilization problems. So what we do is basically we give you a medication to stimulate your ovary to produce more eggs, and we take them out, and we conceive the eggs outside, and we when the embryo is about 4 to 5 days old, we transfer them back.
Right.
And we support the pregnancy with hormones. And basically the outline of the IVF. So that we, basically when someone has condition like endometriosis, where we have internal environment is not suitable to conception, we offer them IVF as a basically final treatment. And
endometriosis is a huge topic and a wide area, so that we can focus on that discipline in a separate program as well. And so like when it comes to those conditions, and if we are performing that IVF in a separate manner, it is not naturally happening. We should artificially intervene, and with that hormones even we are managing the environment in order to properly have that particular pregnancy. Is it difficult from a normal child? That means the
completely
outcome.
No, completely not. Child as normal concepted baby. The only thing is the first 12 weeks, since we are manipulating the cycle, first 12 weeks only we are trying to control to our hand, and once the baby past 12 weeks, it's almost like a normal pregnancy. There will be no absolutely no effect on the baby. It's more or less same
Same, no
outcome,
change.
normally conceived baby. Yeah.
Okay, so when it regards to infertility and subfertility, we discussed a lot, and there were certain investigations, diagnoses, and when it comes to treatments, how they are being processed.
Again, it's basically when you take a good history and you examine and do the first investigation, you find out where the fault is. Sometimes just timely intercourse is enough. Because when the couple doesn't know about the fertile period, or if they are living far away, husband is working somewhere else, we just tell them that this is the fertile period and give proper nutrition advice, lifestyle modification, and timely intercourse will be enough. Then if fails, or if there are issues with ovulation, we call something called Willis Induction. We give medicine to have a nice egg. Then we trigger it with another medication. So we just give them a rough idea of the fertile period. Then they can have sexual intercourse at that time. So sometimes we need to support the implantation, sometimes we don't. So basically, if you get suffered a couple, 60% of will be successful after this kind of treatment. It's like simple thing, not expensive, not invasive kind of treatment. Unfortunately, if you will need, for example, if somebody has endometriosis, they have to go for surgery, or depending on the degree of endometriosis or the problem, we can offer them IUI, so insemination procedures. Those are the simplest way of treatment.
Right. So when it comes to those basic treatments, sometimes, as you mentioned, proper consultations, through proper consultations we can avoid many mishaps. Like the not knowing the proper fertile period might be a big serious issue. Why? Because without any particular medications and certain other consequences, you can manage that thing very easily. So that is the most important and the prime concern. And so like when it comes to those certain factors, as you said, stress should be managed. Certain other communicable or non-communicable diseases or whatever should be managed. So as a physician, how can we advise these preventive aspect of this disease?
That's why important to consult a fertility specialist before you, even marriage, or even, when you try to conceive, few years, ahead. So basically, you can, with your lifestyle modification, maybe cessation of smoking, control alcohol, and control some kind of food and regular exercise. With all that, you can improve your fertility without any medication.
Right. So that means consuming alcohol and smoking seriously affect.
It seriously affects, especially for the female and even males also.
Males also.
Like getting your weight, if you're underweight, get up to proper weight, and if you're overweight, reduction of weight is very important. That resolves many issues with ovulation. So it's very important to get your lifestyle to healthy way. So it's that will control your non-communicable disease as well. Your blood pressure will come down, your blood sugar will come down, your cholesterol will be normal. So it will be easy journey after that. So it's very important to see a doctor and just get advice about a year ahead. So then you have good chance of conceiving without any treatment or intervention.
Right. So with that explanation, I think it's very much clear for you all. And with our previous episodes also, we managed to discuss many topics and disciplines. So when it comes to certain diseases, they will be profound and they will be interconnected with many other conditions. So today we're discussing about infertility and subfertility, and with this explanation with our guest, you might be well understanding that these conditions are closely linked, and sometimes diabetes condition might affect. Sometimes if your blood pressure is high, it might affect. If your lifestyle is not good, it might definitely affect. And if you are not consuming nutritious food, not having a proper balanced diet, it might definitely affect. And despite of all those things, stress, you have to manage the social impact, the impact that comes from your close relatives. You have to manage it, and you have to maintain a proper cool mindset and make yourself relax, and you should proceed, and that will pave most of the way and most of those things in order to lead a successful life. And finally, sir, as a physician, giving a particular advice.
So what I have to summarize the whole thing. As a physician, we can do many things, but as a general, ordinary person, what you want to do is, especially if you are thinking, for example, a couple need to get pregnant, most of them. So we have to concern that, think of that, and then plan ahead. and meet your doctor, physician or fertility specialist about a year ahead and have chat and as your fertility assessed, and especially you are trying to postpone your pregnancy, then you should see your fertility potential and use more suitable contraception method to you, which preserves your fertility. And as he said, lifestyle modification, good nutrition, healthy lifestyle will resolve many problems with regard to fertility.
Right. Okay. So thank you very much, sir, Dr. Sudat Senaratna, consultant in subfertility and IVF, to taking part in today's program of iMed. So we discussed infertility, subfertility, certain consequences, and specifically we focused on IVF as well, giving you advices and preventive mechanisms in order to lead a successful life. So ladies and gentlemen, thank you very much for watching iMed, your favorite show, which focuses certain medical issues and giving you advices in order to lead a successful life. So stay tuned for many more episodes in the future as well. Thank you very much for watching. Stay safe. Have a pleasant day.
It's like doing